Okay, hello and welcome to the last CCE Public Square event for the semester. This Public Square discussion will cover what's next for the WSU community as we collectively try to get back to normal in this not quite post-COVID world we're in. So my name is Haley Rupp. I use she, her pronouns. I'm the Deputy Chief of Staff and Director of Strategic Communications and Initiatives in the Office of the President here at WSU. Prior to this position, I was the Emergency Operations Project Manager for COVID-19, so they just like to give me the longest titles on campus, where I was managing WSU's response to the pandemic system-wide. So I have 2 degrees from WSU, so I'm a Coug twice over. My first one was from Pullman, my second one was from Global. And I'm going to be moderating this panel today. I'm going to start by introducing each of our panelists, and then we'll go down the line and ask them to share a brief statement on this topic of returning to normal post-COVID-19 from their lens. Following, we'll have a guided discussion, and then we'll open it up at the end for questions from the audience. So immediately to my left is Jonathan Stahl. Jonathan is from Urec. He's the Assistant Director for Adventure Programs and Experiential Learning. He's been at WSU for 13 years. At the Outdoor Recreation Center, he instructs backcountry skiing, does avalanche awareness and group fitness classes, and when not at work, he enjoys gardening and adventuring with his family. Next, Dr. Guy Palmer. Dr. Palmer holds the Jan and Jack Creighton Endowed Chair at WSU, where he is a Regents Professor of Pathology and Infectious Diseases and the Senior Director of Global Health. Dr. Palmer was elected to the National Academy of Medicine in 2006, is a Medical Sciences Fellow of the American Association for the Advancement of Science, and is a founding member of the Washington State Academy of Sciences, where he served as president from 2012 to 13. He serves as director of the NIH Medical Training Program in Zoonotic Diseases in East Africa and chairs WSU Global Health Kenya, responsible for the Center for the Research on Emerging Infectious Diseases in 9 African countries.
And thank you for not saying how long I've been at WSU. I really appreciate that.
Graduated last year. Alex Steiner is the Substance Abuse Prevention Program Coordinator in Health Promotion. Applying a harm reduction approach, Alex has frank and honest conversations with students about substance use, how it can interact with reaching goals in other aspects of life, and ways of lowering the risk of harm from substance misuse. Although substance misuse prevention is his primary area of focus, Alex works with colleagues both in health promotion and across WSU to help promote the mental health and well-being of students, as well as preventing sexual violence. Brian Patrick is ASWSU president, majoring in business management with a focus on innovation and change. He has also served as president of the Student Human Resources Management Club and vice president of recruitment for his fraternity Sigma Phi Epsilon. Brian made mental health a central issue for his campaign and tenure as student body president. In his free time, Brian enjoys fishing, hiking, spending time with family, and living the Pullman experience. And then finally, Dr. Jennifer Ellsworth has a PhD in clinical psychology and is the Director of Counseling and Psychological Services at Cougar Health Services. Some of her areas of interest include college student mental health, mindfulness-based approaches, trauma and abuse recovery, and women's issues. In her free time, Jennifer likes to spend time with family and friends, going on walks with their dog, and other activities such as reading. So, welcome to our panel. All right, so I'm gonna have you go down the line in each of you in your lens or your role. So Jonathan, we'll start with you. Can you talk about how Urec has changed or the future of Urec post-pandemic?
Sure, should I be grabbing the mic? All right. Hello, can you all hear me okay? I feel like I've got the Darth Vader thing going on with the mask just inside. The whoosh. Anyway, it's good to see some students here today. It's been a rocky road. It's certainly been an adventure in our world. I believe our office over at the ORC was the first one to reopen on campus. So we've seen a lot of changes throughout the pandemic. Everything from going from leading outdoor trips that were near and far to like taking people backpacking across campus. and doing online clinics and all those things. I'm happy to report, though, that most of our programming is what we'd say pretty much back to normal. You know, we transport people, we go to places. We have a trip going out this coming week, going to Zion National Park, for example. And so most of our programming is pretty back to normal. We're not offering quite as many trips, let's say, in my world, as maybe we have in the past, just due to some staffing. We're still pretty short-staffed, and it takes a while to get our students trained up to the level that we had in the past. Our fitness classes have been down a little bit in participation. I enjoy teaching some group fitness classes, and I know that they weren't as well attended as I would have liked. I believe our building numbers are pretty strong. I know intramurals and competitive sports has also been pretty strong. So generally, our programming's been going pretty well, and we're kind of getting back on track and just trying to help find folks kind of really what they're looking for, because we're not really out of the pandemic, right? It's not really post-pandemic, but we're still trying to navigate that kind of weird space of what are people comfortable in, and what are they demanding, what do they want, and then getting the staff ready to do it. Yeah.
Thank you. Dr. Palmer, from a public health landscape, how have things changed, and do you think those changes will remain?
Wow. That's a pretty broad question. What normally happens after we have a emerging infectious disease incidents like Ebola, Zika, some of these names you remember, is there's a lot of public health funding. CDC gets a lot of funding, and then as that dissipates, it goes back. So public health funding has always kind of gone like this. I think that may change. I hope that changes this time. It's one of the changes I would like to see, because I think people now realize what a pandemic means. It's not strictly an infectious disease event. It's an economic event. It's, as many people here will attest, it's a mental health event. It's an educational event. You guys are kind of the lucky ones, because you're able to navigate and learn independently, but young children can't do that. So there's been a massive educational impact on that. So my hope is that as we move forward, there'll be strengthening of our public health systems, which really weren't up to the task. They did not perform particularly well in this. I think the second thing that we need to see through a public health lens is, one, you don't develop trust in communities during a pandemic. We didn't in the Ebola outbreak, which was in West Africa. You just don't create that level of community trust. We don't have a great deal of community trust right now. We've seen that with vaccine hesitancy. We've seen that with people just not trusting individuals, and we need to find a better way to message and build trust and communicate more broadly. It's easy to say, well, it's the problem of social media. Well, that's great, but that's not a solution. Social media isn't going to go anywhere. We need to find a way to communicate effectively and build trust, especially with disenfranchised communities, which are not just communities of color. They are communities that are not connected to institutions that they trust. So I think those are two of the areas that I most want to see come out of this as we move forward in public health. Thank you.
I guess I get my own microphone this time. Is there any stipulations to the question for mine?
No, I'd just love to hear your lens on
All right, yeah. So from the health promotion this standpoint, and specifically kind of the experiences that I've been seeing. So as was stated in my bio, is I'm primarily focused on substance misuse and preventing that. So there's been a lot of changes to sort of like the day-to-day work that I've seen, both from the very beginning of the pandemic, like when the pandemic really started. Really, when we started changing like how we needed to live, really engaging in social distancing practices at the beginning of last year. So certain ways that we engage with students from programs, from the different conversations that I have with folks, both in groups and one-on-one, had to change simply because your context as students changed a lot. And there's even some emergent data that has been informing some of the work that I've been doing, but really some of the main reasons or the motivations that people were using substances, whether that's alcohol, whether that's cannabis, really anything else that you can think of, those two being some of the most commonly used and misused substances. But really the motivations changed from using it more as almost like a way to socialize, to meet new people, to make friends, to have fun with people, and sort of almost as a stress reliever. And it shifted pretty heavily and pretty almost, you might say, suddenly, especially just talking with some of the folks who've told me these things and their own experiences of just trying to cope with a lot of the experiences that they feel like they were missing out on, things that folks really needed to mourn, like missing out on certain almost rite of passage experiences. So for folks coming into their first year of college, a lot of them missed out on things like prom or some of these other events that other people and other generations and cohorts of students, however you want to phrase that, have been able to experience. So a lot of it was really trying to change sort of the approach and some of the the context of the conversations that I've had with students in this. And also it's changed yet again coming back because as Jonathan mentioned, we're still in the pandemic and we're navigating this sort of middle ground, you might say, of being back in person. And so that also means that some things feel like we are sort of getting back to normal, if you will, so pre-pandemic. But there's also additional context of trying to keep yourself safe, keep other folks safe. So a lot of different emotions, a lot of different experiences that folks are having. So that extends beyond also my primary work of working with trying to reduce or prevent substance misuse. I think this almost goes without saying at this point that certainly people's mental health experiences have been drastically affected both by the pandemic itself, the experiences of just seeing different kinds of information going about online, a lot of different opinions circulating around, but also just different ways that we can interact day to day that's not necessarily, strictly speaking, related to the pandemic in the sense of okay, this is because we're changing this because of the pandemic, but mostly just trying to navigate sort of daily struggles that we all go through. So the work itself, at least from my lens, has not really changed, but what is different is sort of the context, because really ultimately, I can talk all the live long day. I'm kind of wordy, I'm a little verbose like that, but ultimately what I think we all seek to do on different ways is we're just trying to meet you all where you are, and as your context change, that means that we have to adapt to meet you where you are.
For me, sorry. For me, it's a lot of my work is advocacy for students. So a lot of our conversations within our executive staff, Senate, and across the ASWSU system, which includes different organizations and auxiliaries, has been, what do the students need? And what that looks like is, none of us have ever before been told one day that, hey, you have to go home, everything is completely virtual, and you have to get used to that. There was no transition, there was no training on what that looks like and how you're supposed to be successful as a student, especially a collegiate student, with that transition. And then while we lived last year through Zoom virtually, then you're asked to come back to school where you aren't used to those regular day-to-day things. like going to class and being present within the classroom. So I think just from what we've heard from students across campus is that this transition has been difficult. It's even like the little things, forgetting to bring like a mask to class or forgetting, I don't know, something at home. And so what we've been trying to do is just create more accessibility for students. So if you go to different locations, we're trying to provide masks at those locations, as well as just any other resources. Obviously, everyone else on this panel has a little bit more like health background, but for us, we're just hoping to hear from students what students need and how we can help each other in the future.
Good afternoon. We're finding at counseling and psychological services that the pandemic has had a really significant impact on student mental health. I think everyone in this room has been navigating a series of losses, changes, stressors, traumas related to the pandemic. So we know the idea of a return to normal, to me, that's sort of inconceivable because we're still in the pandemic, and also we can't leave behind all of those stressors and losses and difficulties that we've encountered. So those things have a lasting impact on students. We're finding there is always really significant and high demand for mental health services at CAPS. We're finding that it feels higher this semester. We're finding that students are coming in with more symptoms, with more distress, struggling more than they have in previous semesters. I think we're not immune to it. So we're also noticing, we're more burned out than we typically are at this point in the semester. I think that mental health is the area that we're all passionate about, and so we're really cognizant of all the difficulties that students have encountered, and I'm excited to be on the panel. I hope that we'll get to talk today about some specific strategies and ideas and about specific resources that are available to you all. And I just get really excited to talk about treating oneself and each other with some more kindness and gentleness. I think we're going through, oh my gosh, there's all the terrible adjectives, unprecedented times, right? Like we're going through a level of difficulty that I've never seen in my lifetime, and I'm at least twice as old as any of you are. So this is really historical sorts of difficulty and stress that we're dealing with.
Thank you. Jonathan, I put this next question to you. As Jennifer mentioned, it's not really a back to normal. I like to say it's a back to better, where we take what we've learned through the pandemic and change things. How has Urec changed their approach to programming? And do you think those changes will remain to better support our students?
Yeah, that's a good question. I mean, honestly, right now we are, like I mentioned, kind of still pretty short-staffed and just trying to, I guess the mantra is do a little bit less with less. And that's hard because those of us who are in this field, who are in this position, we love recreation, we love coming up with new ideas. And we keep having these conversations at work where it's like, oh, here's this great idea. And we're like, yes, and let's hold on to that maybe for next year, right? Let's like hang on to that. So right now it's really about offering the types of programs that we can offer right now that students really enjoy, that people really want, that we know that they want. And so, yeah, I guess that'll be my short answer to that.
Thank you.
Yeah.
And Jennifer, you mentioned, the limited resources and how students can help themselves. So Pullman is a rural community. I think we've been described as a mental health and healthcare desert here because resources are limited. What are the options for students if they're trying to seek help and can't find it?
I think I'll first, if it's okay, speak to if a student's seeking help and they can find it at the counseling center, what those resources are. We offer initial consultation appointments to students on a daily basis, and those are offered on a same-day scheduled basis. So the day that you decide, I'm ready to call the counseling center and request an appointment, we have appointment slots available for you that day. We're also understaffed. I think that is a message that I'm hearing from colleagues across campus. So there are times when our same-day scheduled initial consultations fill up. I encourage people to call as early in the day as they're able to. And I also encourage students, if you're in crisis, please let us know, because we have those initial consultations, and if they're full, we might ask you to call back another day. But if today is the day that you need help and things are pretty serious and you know that you need to talk to somebody that day, let us know. We also have crisis appointments available. We'll help connect you with a counselor. We offer a range of services, and I really like to talk about the range. I think most people are familiar with individual therapy, and that feels a little bit more comfortable, I think, to most students. Like, they can talk with someone like me sort of one-on-one, and it's very private and it feels more comfortable. And the idea of like a group or a workshop can be a little bit intimidating. I really believe, though, in the power of groups and of being together in community. I think especially when the pandemic has been so isolating for people, to be in a room with other people going through similar struggles can be really, really meaningful. Also, I should clarify right now for us that's a virtual room. All of our groups and workshops are being offered via Zoom. We got a lot of experience with that last year. We've continued it this year because as people encounter, maybe you're sick with a cold and you don't want to get other people sick, or maybe you're dealing with a COVID isolation period and you're not able to come to the counseling center. We just want to increase the access, and we want to be able to have people joining us every week. So our groups and workshops are available. Those are all over Zoom. We offer individual therapy appointments, although the demand for that can get pretty intense, and we're pretty full at this point in the semester. And those are available either via Zoom or in person. We also have our crisis appointments, our initial consultations. We try to get out and do some outreach and prevention work and share information with students. And I think for us, one of the silver linings of the pandemic, none of us had ever provided telehealth appointments at the counseling center before. That wasn't a service that we offered. And one of the advantages to that is that we have more accessibility during periods like Thanksgiving break, during the holiday break, during the summer. It used to be that you had to be in Pullman during the summer in order to access counseling services. Now, if you don't even have to be enrolled during the summer. If you are a student during spring and you're coming back in the fall and you're going to be in the state of Washington, you can do virtual appointments with us throughout the summer. So we're really glad for the ways that's expanded our access and accessibility for students.
Thank you. Alex, what kind of activities can students participate in maybe on their own to help navigate if they're feeling stressed or having other struggles?
Ooh, okay. So some stress management strategies, if you will. So I like to break this down into, as far as like stress management is, and anybody who's attended a stress management workshop this may sound a little familiar, but I like to break this down into sort of some things that people can do kind of in an immediate moment if they're feeling sort of a little overwhelmed, having a little bit of stress at in a particular moment in time. One thing that can be helpful, and honestly even just trying to can help sort of like with reframing kind of what the situation is going on, is just trying to give yourself a little bit of grace, taking a moment to take some deep breaths. I know that sounds not like it can be super helpful, but honestly, giving yourself a little bit more time to respond to a stressful situation, or just all of the different things trying to demand your attention all at once on a given day basis, or in a certain week, or whatever is going on in a particular moment in time. Giving yourself a little bit more time to respond as opposed to react. Can also give yourself an opportunity to be a little bit kinder to yourself. Sometimes, especially in really stressful situations, or if we don't perform up to our expectations for ourselves, we can tend to beat ourselves up. That's not something that happens for everybody, but that is a common experience. We tend to not give ourselves as much grace as we may give to people that we care about, like our friends or our family, when they make a mistake. So that's one thing that we can do in the immediate moment. There are some different exercises that, well, I call them exercises, but some things like so a neck relaxer exercise that can help folks in that moment as well, just sort of help decrease the amount of tension that tends to build up in our neck, our shoulders, whenever we're feeling like really tense or under a lot of stress. There's also things that we can do. That's more of a sort of a reaction approach kind of a thing. So there's a few things that we can do in that moment if we're feeling really stressed out. Some things that I would recommend to sort of give yourself a better chance for on a long-term basis, sort of like going forward, being a little bit more proactive as far as stress management goes, are engaging in some self-care practices. And when I mention self-care, that really can be a bit nebulous, but what I really mean is sort of any intentional action that you do to take care of your physical, your mental, or your emotional health. So that's the definition that I'm using at this point in time. So that can really look like a lot of different things for different folks, but some suggestions that come up to my mind that it can be helpful is maybe talking to a friend or somebody that you trust. Can be like a parent or maybe a sibling or somebody who you feel comfortable sharing what's going on. And can be sort of like in a safe environment to do so, so where that person's not going to listen judgmentally, for instance. So reaching out to them can honestly just be helpful, just to get some things off of your chest. Creating maybe if you have access to it, like creating like playlists to or like motivate yourself to go work out. Trying to find potentially like some volunteer opportunities to stay connected, or even find new connections into the community, meet new people, make connections that way. These are some of the strategies that come into my mind, sort of as ways to sort of help lower the chances of stress kind of building up over time and getting to like really stressful points in like a semester or in a given year, where you know, your stress, anxiety, things like that can start. Your anxiousness can really start expand. You know, really feeling like you're feeling overwhelmed. Another thing I will mention, because I feel like I've been talking for quite a long time, I apologize for that, is also giving yourself breaks for working, whether that's academically or whatever tasks that you are working on, whatever things that you need to do for other folks, sort of like expectations as part of like different groups that you may be for, or different classes. Making sure that you don't necessarily set yourself up to be in a situation where you need to, for instance, like cram for a test the night before. So building certain things into your schedule, like breaks, like making sure that you're getting regular meals and you're actually being able to eat on a regular basis. Getting the amount of rest can be really helpful as well. So these are some of the suggestions that I have as far as like stress management goes.
Thank you. Brian, we've had, as an administration, I feel like we've gotten a lot of questions and frustrations from students and faculty and staff about the constant changing guidelines out of the state and the federal government and things like that. What steps have you taken to adjust as a student and as a student leader in these constantly changing times?
Yeah, so great question. So as a student leader, something that I've been doing, just because things are constantly changing, I have pretty common communication with President Scholes as well as Provost Chilton, just making sure that if there is news that comes up, that we are also hearing about it, so that way we can share it across our system, as well as just having constant. I mean, a lot of my time is meeting with administration and making sure that we're staying up to date on what the university is doing at a system-wide level, so across all 6 campuses, as well as focusing on Pullman. And so that includes working with Ellen Taylor, who's like the interim student affairs person, and then we have a health and safety group as well that is constantly working with Dr. Joel for Cougar Health Services. But as a student with things that are ever changing, honestly, it's tough at times. Like it's difficult to balance school on top of your social life, on top of your relationships, and it can be like really daunting. And so something that I've been kind of, with things constantly changing, something that I've been trying to do is just being like really intentional with my time within my leadership position as well as my personal life. So if I'm in a place, if I'm on a panel, I'm at the panel. That's what my mind is on. That's what I'm thinking about. But if I'm with my friends, it's just making that time count. We had an entire year where we had to social distance, and that's still in play a little bit. But times are changing to a little bit of a new normal where you are able to spend time with your friends. And from losing that to having that back, it's something that I try and appreciate. And I've been trying to tell other students as well to just appreciate the little things that come around. The Cub does like PB&J Wednesdays where they hand out PB&Js, and it's like, I don't know, just do little fun things that happen around campus.
Thank you. Guy, along the same lines, I think we've all experienced that the line is no one knew how to respond to this pandemic, and then it's continued to change. We got to stop wearing masks for like 3 weeks, and then we had to start wearing masks again. What do you think that we are learning from this pandemic, and how will it be applied to hopefully avoid the next pandemic?
Well, I think one thing we learn is viruses don't read the textbook, they write the textbook. If you told me 2 years ago you would have a respiratory virus that could be transmitted by people without showing any symptoms, I would have told you that is extraordinarily unlikely. That's not how respiratory viruses work. They make you sneeze, they make you cough, so they can be transmitted to another person. Well, that was wrong. I think we're always kind of in learning how to respond to viruses, to pandemic viruses, or any kind of pandemic infectious threat. The good news is this pandemic, or at least the impacts of it, they are going to end. This is going to come to a close as vaccination spreads. We now have new therapies by Pfizer and Merck that are coming out that actually treat symptoms by tablets in the early parts of infection. So we're going to actually move out of the pandemic, and I think that's important when you focus on it from a mental health perspective. Is you've got to see the light somewhere at the end of the tunnel that doesn't look like another train coming on, and I think we are getting to that point, and I think that's been really frustrating. You talk about how it keeps changing. We felt, okay, this is something that's going to last one semester, or it's going to last 1 year, and then it's going to be over, and that hasn't been what's happened. It's kind of been continuing with these kind of changing rules and changing regulations. But it is going to come to an end. The impacts of it are going to come to an end in terms of hospitalization and things like that as we move forward. So I think that's really important to just keep in mind, is that there is going to be an end to this. Is it going to reset completely back to normal? That's really hard to say. How much we'll continue to wear masks, the impacts that have had on people's education, their health, their economics. It's shown put a real spotlight on some of the challenges for women in the workplace when suddenly their children couldn't go to school. Tremendous impacts that will be long lasting. So So from a viral point of view, I think we're going to see the pandemic come to an end. From some of these other impacts, they're going to be much slower to be resolved, and I think are going to require some of the new strategies and some of the strategies that the other panelists have really emphasized.
Thank you. Jonathan, we're headed into the end of the semester where things get more stressful. What kind of offerings does Urec have for students to get out and be active and participate?
Yeah, like I mentioned, we have a trip that's going out for this whole next week, going to Zion National Park, so people get a chance to see a new place, go hiking and camping, and just relax, and frankly let us do all the work of like driving and planning, and just get to sleep in the car and just wake up and be in the desert, and that's pretty exciting. The other things that we typically do that we'll continue to do is we have a program called Sweat the Stress. So during the week of finals, we'll have a lot of free fitness classes going on where you can come and just try stuff. Kind of going back to what you were saying earlier, like just finding something that works for you that helps you reduce your stress. So we have all different types of fitness classes that'll be advertised online, and you can just show up and try something and just literally sweat the stress away.
Awesome, thank you. Jennifer, you mentioned all of the great ways that students can get in contact with CAPS at Cougar Health Services. Are there any other activities that they can do at home to help navigate this pandemic?
Yeah, I love that question. Thanks, Haley. I think one of the most important things that we can pay attention to is just our foundational needs. That's what I go back to when I'm stressed, when I'm burned out, when I'm overwhelmed. In my mind, our foundational needs include sleep. Sleep is so critical. I lose so many IQ points and so much patience and emotional regulation when I'm not getting enough sleep. It's really noticeable. So prioritizing sleep is an important part of your foundation. Also, eating and drinking well is really important. And that's going to vary from person to person. Maybe you're a person who gets so busy during the day that you are constantly missing breakfast and lunch and get to the evening and are ravenous. Eating more regularly through the day might be what you need. For somebody else, it might be you need more protein. But think about for yourself, what does eating and drinking well look like for you? Another really key area is movement. And for some of y'all, that's going to be exercise. And I love that Jonathan's talking about Sweat the Stress Away and some of those opportunities to really get active. Sometimes when you're super overwhelmed, you can't manage like a full workout, but just moving, getting out and going for a walk, taking a little dance break in your room, those things can be really important. I am not a natural exerciser. I often wish I were. I admire people who are. I'm a talker and a learner, and I don't know, I like to sit and read a book, but I'm very, very convinced through the pandemic that I actually need movement. So I've started to prioritize 30 minutes a day, just going for a stroll on the treadmill while I watch TV, and I feel a lot better physically and emotionally. So those are really key areas of your foundation to pay attention to. I always go back to basics when I start to feel overwhelmed, because often our self-care is the first thing to go. When you've got so much to do with class and so much to do with work, it's easy to skip meals, it's easy to skip workouts, it's easy to feel like you're finding more time in your day by not sleeping, but those things are really going to set you up for success. I think another really key need for us is connection. And one of the challenges in the pandemic is that it's been so isolating and that we haven't been able to be with our loved ones, with our friends, with our families. We absolutely need connection. So think about in your own life, where can you get more of that? Maybe that's in person, maybe that's with friends you have on campus. Maybe you're feeling a little lonely and isolated on campus, and so connecting with friends and family back home would be helpful. But really sort of prioritizing a feeling of care and connection with people who care about you and love you, and finding community, that's really important.
Thank you so much. All right, I'm going to ask this last question, and then we'll open it up for questions from the audience, but I'm going to ask each of you to respond. We've talked about so many negative things that have come out of the pandemic. We are all struggling. This is certainly unprecedented, to use the favorite term. What's one thing that you think is a good outcome of the pandemic that you hope remains? And we'll start with Jonathan, and we'll just run down the line.
You like starting with me.
Yeah, you're closer.
I had a mental note for next time. No, that's actually, that one's pretty easy one for me. In my area, you know, I've been focusing a lot of my answers on outdoor recreation because it's kind of my area of Urec. But when everyone was trying to figure out what to do during the pandemic, we pretty quickly learned that being outside was one of the safest places we could be. And I think I've just been excited to watch a lot of other people identify going outside as a good means of stress reduction and building connections with other people. I mean, if you're not somebody who goes to the gym, you can go for a walk. You could invite someone else to go for a walk. I've been hearing a lot of people who have just been going for walks and how therapeutic that could be. Meanwhile, the outdoor recreation industry has been booming. I mean, our rental shop, I mean, it's hard to keep things on shelves because people just want to get outside and go camp and go boating and do all those different things. So that's just been really fun to watch, even though a lot of the trailheads have a lot of cars at them, and I don't always like sharing, but no, that's actually been a really great thing. The other thing that I would say that's been, I think, really healthy is from a workplace standpoint, like learning how to continue doing our work without being in an office. You know, we've been in the office for quite a while, and yet there are still times when, you know, last week I was home with a sick kid. And some of that time I really needed to keep up with some work, and I was able to do it very easily now. And that's like one of those things from the pandemic that I really hope stays with us, you know, in terms of that workplace culture.
A good thing to come out of a pandemic. Everybody now knows what an epidemiologist is. Before they thought they took care of bugs or something else, or were a dermatologist. Now they know the difference. So that there's been some learning on that. You know, because I tend to obviously focus more on the things around the infectious disease itself. You know, we will respond. This won't be the last pandemic. I hope it'll be the last pandemic of our lifetimes, but you can't guarantee that. And it's actually unlikely. I don't know whether we'll have another one of this scale, but we will have other disease outbreaks. We will respond faster and better next time. We have learned a lot about how to better roll out vaccines, how to do them quickly, how to do advanced purchasing requirements. We've now got better antivirals, these new drugs that will come out. We will be better equipped in the future.
Positive things coming out of the pandemic. This is not necessarily related specifically to kind of the work that I do. This is just something that I've noticed both for myself as well as a lot of other folks I've spoken to, is that people started getting really creative with ways of being able to connect with folks, whether that's meeting new friends or trying to find different ways to stay connected with the current friend group or their loved ones, whether they're back home or wherever they may be. One thing that I noticed, actually, I'd never actually thought this would happen, but I myself actually ended up building a computer while during the pandemic. So just getting, just people looking for new things, or even just having the opportunity to reconnect with old hobbies or old interests that they may have been neglecting, or ones that they kind of let go by the wayside because they were so busy. I've heard from a lot of different students who really picked up or got back into art, for instance. Like they started painting a lot more. They started feeling more comfortable sharing their art with other folks. And being connected that way. So just, I think some of the emphasis on people getting reconnected with things that bring them joy, I think is something that's I really hope sticks around, and we can sort of continue to encourage that for everybody.
I would say for me, definitely, I agree with what everyone has said so far. A lot of the like outdoor recreation, that's really changed. I've seen it with myself as well as a lot of my friends, just wanting to be outside more, playing more like weird yard games, like can jams, my new favorite. But it's been fun to like, that's what I've seen as a big benefit coming out of the pandemic, or like as we are kind of moving through. And then personally, or like more work related stuff, it's amazing to just be able to hop on send someone a message on like Microsoft Teams or on email, and just say, hey, can you hop on this like Zoom real quick? Instead of having to like go set up a meeting time. It just makes life so much easier to just be able to message someone right away. And also with family too, my grandma's not that great with like her phone, so like the FaceTime stuff doesn't work. So the Zoom button is a little bit bigger on her computer, so it's nice to be able to communicate with family.
Yeah, I'll echo that. I think one of the big changes in the counseling center that I'm most excited about are the telehealth appointments, and just seeing how many more students can access therapy over the summer or over winter break. That's incredible, and I don't think we would have gotten there, certainly not this quickly, without the experiences over the past 2 years. And then I think my other thought echoes some of what's been shared. I've really enjoyed getting to talk with people who've done a lot of reflecting on their values and on what they want out of life, and talking with friends or colleagues or students who've decided, like, life is short. I want to move and live closer to family. Or life is short. Like, these are the relationships that are important to me. Or this is how I really want to spend my time. I want to get back to activities that are meaningful to me. I think that's been a really valuable part of the pandemic.
Thank you. We will now open it up to any questions from the audience.
Just grab a mic, turn around, and ask questions. I guess I'll start. Brian, could you tell us the name of your favorite yard game and give us a brief description of it?
Yeah, so my favorite yard game is Can Jam. So what you do, has anyone played Can Jam? Maybe. Okay. So you have like two like plastic bin things, and you have like a teammate, and you throw a frisbee, and there's like different points if you make it into the can, then you could jam it, and that's a lot of points. It's kind of hard. Yeah, it's kind of hard to describe. Like you have to Google like Can Jam and possibly buy it. It's great.
Thanks. Any other questions?
So this is for you. I'm a resident advisor at Straight Parham. So with my residents approaching me a lot for like mental health issues, one of my go-tos is CAPS because it's on our campus. And I know you talked about like on the same day they get in for a consultation, but after that, how long is that time period where they actually start, the counseling or other methods you guys use?
First of all, I just want to say thank you for all of the support that you offer to students on campus. I just think resident assistants are doing incredible, incredible work to support students at the same time that you're a student. So the question is, you can get in on a same-day basis for an initial consultation, but what happens next? None of us knew what to expect in the counseling center going into this semester. It was a really common thing for us to say to each other, I don't know, I've never had a fall semester following a year of remote learning, during a global pandemic. So what we're finding is that definitely there's a lot of demand, and we had more accessibility and availability earlier in the semester. So I would encourage all of you, if you start to notice that you're struggling, if you're talking to a friend or a resident who's struggling, I'd encourage you to come see us sooner rather than later. It's so much easier to get an appointment in September or early in October, and by November it gets pretty crunchy. So we do have a wait list right now for individual therapy. We're working to try to offer at least one appointment to everybody who's currently on the wait list. We also know the wait list is longer than we'd like it to be, and so we're not adding students to the wait list at this point in the semester. But we do still have some access to some of our workshops and groups. And we always like to have that first appointment just so we can find out what's going on. Because if what's going on is, I'm really stressed out about school, but I think I'm going to be okay, and I'm looking forward to going home for Thanksgiving, then I can feel like, all right, catch us next semester and we'll connect you with some resources. But if a student says, I'm really thinking about suicide and it's pretty bad, oh my gosh, we're going to find a follow-up appointment for that student.
Okay. Thank you.
Yeah.
All right, Guy, what do you do for fun?
Oh, I just read scientific journals all the time. What do I do for fun? Well, I have a lot of outdoor recreation. I've been up Kamiak Butte more times in the last 18 months than in the previous 20 years. But what do I do for fun? Skiing, whitewater kayaking, just outdoor stuff. That's probably my number one thing that I do. I've always enjoyed international travel, but there hasn't been much of that recently. But I am going back to Africa for the first time in 2 years, right after Thanksgiving, so I'm totally pumped about that. So yeah, those things. Outdoor stuff, I've always enjoyed outdoor stuff, and that was, as I think many of you would that was a great thing to do, especially when we were quarantined and couldn't do anything else. But that really helps a lot.
Yes, I think the answer is last 18 months for Guy was Kamiak, next 18 is Can Jam.
I'm gonna get on that. I'm gonna be checking that out.
I don't know who to quite direct this question to, but what do you suggest for like people who are graduating or who are going to be alumni that now don't have access to these resources on campus, and like what do you do then, and where do you go to seek help or resources then? I don't know who to direct that to, but yeah.
That feels like a me question. I'll go ahead and take a first go at it. The Counseling Center has great resources, of course, but I also often talk with students about working with their insurance company. I know not every student has health insurance, so this may not be a one-size-fits-all. But if you have health insurance, that's a good starting point. Often on your insurance card, there's going to be a number on the back of the card that you can call to get referral information. So a lot of health insurance companies have a specific referral line for behavioral health services. So they can help you find a counselor or a therapist who's in network with your insurance company, and you can access professional mental health care that way. Many communities also have mental health clinics that operate on a sliding fee scale. For example, here in Pullman, I don't know if you're graduating and staying in Pullman, but if you are, have I got a resource for you? We have a PhD program in clinical psychology here at Washington State University, and there's a department clinic that's staffed by those PhD students who are receiving incredible supervision from experts in the field, and they operate on a sliding fee scale that makes the resource a little bit more affordable.
Perfect, thank you.
The only thing I'd add to that is the beauty of being a Coug is that when you graduate, you just join the biggest family of wonderful people in the world. So, I mean, Jennifer's mental health resources were so great and helpful, but another option too is just to reach out to an alum or reach out to a classmate or reach out to somebody. Cougs help Cougs. So know that you always have resources here, and we can get you connected with whoever you need.
I don't know who to direct this to, but what was the scariest part of COVID for you guys?
asymptomatic transmission, because I wasn't prepared for that, because it changed everything we had to do here at the university in terms of testing, and it took it from a clinic-centered approach to a community-centered approach, as all of you experienced with your arrival testings and things like that. That was the scariest moment when I realized this was going to behave differently than the models we had based previous understanding of coronaviruses on. I'm always going to give you a medical contact.
For me, I have kind of two scares. I know you get two for the price of one, if you will. But I had sort of a professional situation that kind of scared me, and I also had a personal one. So the professionally speaking, so with my field, really what was really scaring me is something that honestly, I'm still trying to figure out the best possible ways of helping folks through this, is the comorbidity of people using substances to sort of like help treat different like mental health symptoms and just issues that they're struggling with, along with folks just honestly just struggling with that. So really just it's really people just turning to substances more and more, and sort of a general trend of increasing the risks for just exacerbating the struggles that they were already dealing with, but with also potentially throwing on substance use disorder as well for certain folks. Obviously, not everybody was in that same risk level, but there was just with the sort of the kind of the shift in almost like motivations that people were using substances. Definitely gave me a bit of a scare, actually quite a bit of a scare, and even now still trying to figure out sort of like the best ways of trying to help folks, especially who are doing that for themselves. Personally, for me, the biggest scare that I had was my mother had recently just right before the pandemic really hit the U.S. She was still finishing up treatments for cancer scare that she had, and so she was sort of in a really vulnerable place. So I'm also 2,000 miles away from her, so not being able to. Really not feeling like I was able to do anything to sort of help out or even get there quickly if she did happen to come down with COVID. So there was some scary things that way.
I'll jump in. So that's a real question, and I'll give you a real answer. I was going to try not to cry, but I'll probably just cry. My family, my spouse and I have best friends that we've known for 15 years. And our friend Andy, who's my age, he's 44, fully vaccinated, got a breakthrough case of COVID and died from complications of COVID. So one of my best friends, Jen, is a widow. She's got 4 kids. They're between the ages of 5 and 15. It's horrifying in a lot of ways. And I think the message I would share is it just reinforces for me like how serious this is and how important it is to follow all of the public health precautions, to get vaccinated, to wear a mask, to socially distance. And they're living in a community that's much more, I don't know how to characterize the community. There's a lot of anti-mask sentiment, a lot of anti-vaccine sentiment. And so as she says, hey, the thing you can do to support my family is to wear a mask. It really matters to us, and my kids cannot lose another parent. And if any of us get COVID, we'll be terrified. Some people are willing to do that, and a lot of people are not, which just blows me away. So it's really I think I already have a lot of compassion for the losses that people are experiencing in the pandemic. This has certainly increased my compassion, and I just feel like, man, if it's low stakes for you to put on a mask, put on the mask.
I'll give a real answer as well. I've got 2 kids, and since the beginning of the pandemic, it's really just about been trying to keep myself safe and them safe. We were definitely pretty nervous about coming back in person. Respectfully, like, I love working with college students. Absolutely love it. It's why I'm in this field. And honestly, kind of also freaked me out. Like, the idea of, my wife teaches a class on campus, and we're just like, how do we do this in a way where we can give all that we want to give to our students, but also keep our family safe during this time. So that's been pretty scary. And on just a very personal level, like, I've shared a lot about recreation and fitness, and those are the sort of things that I've learned in the last bunch of years that I've used throughout my life to keep me healthy, both physically, emotionally, mentally. And in the first, part of the pandemic, I'm like, oh yeah, I got this. I'll keep doing all those things. I know how to do all those things, and I did, and I felt pretty on top of it. Then I tore my ACL skiing. And all of that was really taken away. So now I have managing, life in a pandemic without the stress management of doing all the things like running or any of the things that I normally do to keep me healthy. That was pretty scary, and it's been, it's been rough, to be honest. That's been really challenging, but working through it.
Yeah, one of the scariest things for me, also kind of personal, but when like the pandemic first started, there wasn't like a ton of information out and stuff, and so my sister had just had her child, so first nephew, but just not knowing, like, we had to be so safe, and it was just kind of scary because his dad was like had to work with around a bunch of people still, so just the uncertainty and not knowing was pretty scary. The other thing that's scary and just kind of disappointing, I think, is just like how divisive it's been. The amount of family and friends that have like in my life, and I know other people's life as well, just like aren't talking to each other because of their beliefs on this. It's just sad. It's kind of sad and disappointing. So.
Awesome, thank you. I want to thank all of our panelists today. We're at time, but we really appreciate you being here and sharing your thoughts. And I also want to thank all of our students here. You guys got vaccinated, and we got to come back to in person, and we are all very, very thankful. So thank you all for attending. And if you have any questions, let us know.